I haven't received any apologies.
Has anyone got any apologies for anyone else?
No apologies, just other than that I'm going to be on the phone with camera off because I'm going to be driving for the next 15-20 minutes.
Yeah, no worries. Thank you. Drive safely.
Thank God.
Thank you. The joys of trying to get children to locations.
Absolutely. So agenda item 2, any declarations of interest. Members are asked to declare any disclosable, pecuniary or affected interest and the nature of that interest as listed in the agenda item. So I know all round. Excellent. So, as we all know, at the overview and scrutiny, our first review was accepted to go ahead, which is excellent. So that is going to be the sexual health review. And the reason for the review is to test if sexual health service provisions was sufficient to meet the needs of young people in the borough, with a particular focus on how people access the services. So the key areas that we're going to test is access to sexual health clinics, identify reasons for issues with access with a focus of those aged under 25, access to protective contraception, identify reasons for any issues with access with a focus of those under 25, is engagement with Asian, Black and White other women regarding access to contraception advice and services sufficient in the borough. What does the PHSE provision in schools cover regarding sexual health? Is information provided about how young people can access local services? And spending for money, what impact can improvement to sexual health services have on wider local authority budget? And also, we have to understand the viewpoints of young people in the borough with regards to the sexual health provision. And how are we going to go about this? Well, over the next week, we're going to be doing scene setting meeting and review of public health data. We're going to use the involvement of young health champions. We're going to do a desktop review of school relationships and sex education RSE policies and review analysis of Safe Sex Berkshire website, focus on access and provision of services, and mystery shopper exercises, contacting visiting services to gain first-hand understanding of sexual health services. And then we're also going to interview other local authorities to see how they're doing and what we can learn from them. Does anyone have any questions?
Comprehensive.
Nobody has any questions? I will move on then. Brilliant. So may I invite Councillor Wright to speak at this point?
Thank you very much, Councillor Eggleston. So I'm an executive member for health, and I suppose my first sort of exposure to the sexual health services in Bracknell was that letter, that email that we all got sent, and was sent to a couple of journalists as well. So it was quite a rude awakening, to say the least. And obviously that prompted me to ask quite a few questions about what was going on in the sexual health provision. And so very quickly I became friends with Bex, who gave us quite a few updates. And in doing so, I was able to visit the garden clinic in Slough and speak to the people who are managing the contract from the NHS point of view, so from BHFT. And we also had, at the same time, we had the emerging issue of youth services providing contraception, providing access to contraception in schools, being a service that wasn't really was separate to what was going on with regards to this current contract with the forest, the garden clinic, and because of issues there, what this came to light because the doctor who was currently working on that provision was about to leave, and it was only really that it came to light there that this wasn't really being supervised by or wasn't having adequate supervision by public health at Bracknell Forest. So we have a situation now, which I'm sure is why you've called this review, about looking at what are we providing for young people? Is it good enough? Are there any gaps there? And you know, we have had to stop a service that's going into schools, and for very valid reasons, but at the same time it's not ideal to stop a service without a plan for how you're going to replace it. So I'm really glad that you've called this review. I think it's the right thing to do, and I'm glad that you've been quick about it, and it would be great to kind of have a quick response from this, so that we make sure that we are providing adequate services for everyone in the borough, and especially the under 25s, because I feel it could potentially be a real risk for young women not being able to access adequate family planning services, as well as all the other, prevention of STDs and awareness there. Rebecca Willens has done a fantastic presentation. I'll hand over to her, unless there's anything else I need to say prior to that. Is there anything I've missed out?
No, thank you very much.
Okay, Tony's got his hand up, has he?
Tony, Councillor Virgo, would you like to?
Oh, sorry, Councillor Virgo.
Yes, please. Megan, what is the cost? Have we got costs on what we're paying to this company that's supplying it? That would be my first point. And is there a proper contract that that the committee can see and read with the original, with the original installation of the company? I can't think of the word, but can we read something in what we're paying for this company to actually do?
I don't know. I've not seen. I might have seen the order. There's two things here, aren't there? Because we've got the contract for the supply of the actual medical. The supply of the actual medicine. So that's the long-acting contraceptive, and also the emergency hormonal contraception. And then we also have the contract for the actual provision of the services. So the sexual health workers, the clinics, etc. Bex, are you able to give summaries of those costs?
Yeah, I'd have to pull them up on my screen, but I can get those for you. Yeah. In terms of the committee being able to have access to a breakdown of what we've paid in the previous financial year and projections for next financial year, I can supply that. And also I can supply we call them service specifications. So that's what the provider has to work to. So we have Berkshire Healthcare Foundation Trust, who provide the bulk of the sexual reproductive health services. We have some pharmacies who provide what we call the emergency hormonal contraception service, which is just targeted at young people, so people aged 13 to 24. And then we have the long-acting reversible contraception, which local GPs provide. So I can provide the service specifications for those three different services and the underpinning contract.
Can I ask a further question, Caroline?
Yes, go ahead, Councillor Virgo.
Rebecca, just following on for that, obviously some of the complaints that we had with the service were that it wasn't very accessible to people because the number of days, in fact, I think it was open to the public, to the residents, was about 1 or maybe 2, which seemed to me totally unacceptable, to be honest. And I wondered if this was on the original contract that Bracknell, under Dale, actually, I suppose, let's be honest here, under Dale Birch signed with the company, or whether that's just transposed that way.
So the contract that Berkshire Healthcare are currently working to, which ends at the end of June, doesn't specify the number of days of a week or the specific opening hours that they need to provide the services for. They deliver under what's called a block contract. So they have to deliver a wide range of provision, and within the budget envelope that we give them, they have to work out what's financially feasible in terms of the number of clinical sites they're able to open, and how the staff, because they have a small number of staff that operate across those sites. So with the new service specification we're moving to, we have asked that they review the number of sites. We've also asked that they review the online provision, because although online access isn't suitable or appropriate for everyone, what we saw within Bracknell Forest, indeed mirroring national trends during and ever since the pandemic, is a public preference for online sexually transmitted infection testing. So it's been recognised that's sort of a necessary part of the service model. And what it means in terms of what you're getting at, which is sort of physical access for patients who need that. The idea is those patients who don't need to walk into a clinic face to face and who are happy to go online can do so. And that should mean more provision for those patients who want to or need the face to face access. So we're still working on that with BHFT at the moment to look at what provision specifically in the 3 boroughs covered by this contract will get from the 1st of July of this year.
Rebecca, you see, the thing that worries me with what you just said is that it's all based on internet and not on personal communication. From my experience, people that have a sexual problem, not necessarily pregnancy, but a sexual problem, men and women for that matter, boys and girls, need to go to see someone to talk about it. And they find it terribly embarrassing that they've got it, right? And they don't know who to turn to. And the sexual clinic at the Garden Clinic at Slough is a pretty good, provision, actually. And it does that, exactly does that. I think if we move completely, which I certainly wouldn't be in favour of moving completely to the internet, I think it defeats the object of personal, communication between the patient and the clinician. And it worries me enormously that we go into a contract and we don't even state the number of days that clinic would be open. I find that absolutely amazing, to be honest. I just think, why would I do that? I wouldn't leave it to Berkshire to tell us, oh, well, you can only have it one day. I'm sorry, I'm being a bit forward here, but I just think that is not a good value for money for the residents of this borough.
Hence, that's why.
Sorry, Caroline, I've gone on.
That's okay. This is why we're having the review. We've got to, obviously, we're paying money for something that we might not be getting the best service for. So that is what we need to gather the evidence.
Yeah.
Bex, before I hand over to Councillor Harrison, what is the timeline from, say, somebody who wants to see somebody face to face? How long is it taking before they actually see somebody in or outside of the borough, if they have to go to Slough or whatever else?
Yeah, so within 2 days, that's our key performance indicator, and the service deliver at about 98%. So 98% of people who need to be seen are seen within 2 days of contacting the service.
Thank you. Councillor Harrison?
Yeah, thanks, Caroline. The question I wanted to ask is I'm actually quite surprised, because the email that we had, the complaint that we all had, I think, was the first that I've had in about 25 years. But then I'm not actually that surprised. If you come back to the sort of issues Tony was talking about, that there's an embarrassment factor there, and I think that's probably why, if there is dissatisfaction with the service, people are unlikely to be approaching us as counsellors. You know, you're not going to go to your local council and say, I've got a sexual problem that needs attention. So we've got an issue that it's going to be difficult for us to get hold of the truth about what's going on and how people's experiences. And does anybody have any ideas about how we can get that information sort of from the users in a way that doesn't embarrass them? And I'm going to disagree with Tony about people not wanting to use the internet. I think that's the ideal forum for talking about something you're embarrassed about. I wouldn't think people would want to go and see somebody in person. They'd probably rather initiate the contact over a chat bot, a chat forum or something like that, and then be given the things that they can do. But then there need to be options.
Councillor Welsh.
Yes, so I actually took a phone call from the resident who sent the letter, and obviously the 1 day a week was a big concern, but they were more concerned about the amount of the online tests that could be sent out, as in if we were to increase that, I think they would be happy with that in the meantime until we can find better solutions further on. And I do agree to a certain extent, people like to be seen face to face, but if it is embarrassing, I think they will like to go online and just, have a test sent out to them in that manner. I'd also like to know really what is done on social media, because if we're looking at younger people under 25 who use a lot of social media, what is being done in that arena really for them to see what they can access?
Mm. Mm.
Would you like me to respond to that? Sure. So with regard to social media, we previously had a public health communications team, and they did do a lot of promotion, particularly of the Safe Sex Berkshire website and any national campaigns. That team were no longer funded from last year due to insufficient budget, basically. But we do still work with BHFT's, with Bracknell Forest comms team and the other communications teams in the borough for things like HIV testing week that we might want to promote. We're currently working with colleagues in Berkshire West, so the local authorities in the other half of Berkshire, because they also fund the Safe Sex Berkshire website, and we are scoping a review of that at the moment because that hasn't been reviewed, particularly since the pandemic. So although we anticipate, I've had my own staff look at things like making sure the links work. What we do know based on our analysis of it is most people accessing our local site, Safe Sex Berkshire, are going there specifically to access the pages about service provision, specifically most often using a mobile phone and looking to get STI testing. And so what we've said to the organisation that we commissioned to run the website, Reading Web Services, is we really need to look at what the best product is for local people, because there are other websites that we might want to post them to as a local authority. I think I previously gave the example of Brook as a website that is designed for young people, where they have far more resource than I think the local authority could ever invest to really keep an up-to-date website that's got really good functionality. So it's not saying we won't do anything locally, but we need to acknowledge what people want in terms of a local online provision, and also what we recognise as good quality, trustworthy sources. We just did some focus groups with young people in Bracknell Forest, and something they flagged was that anything that's got the word sex in is often blocked on their school computers. Mm-hmm. And also they said, if my mum's checking my phone or they've put parental blocks, anything with certain keywords in is going to get blocked or they won't look. So it's those kind of things we really need to explore. What do people need us to do locally that complements the national provision? So I hope that's answered what you were asking about, Councillor Welch. I think you mentioned online STI testing as well. Sorry. Should I speak to that too? Yeah.
Sorry, I didn't hear you say. I mean, I'm just here as kind of to introduce Bex, but what I was going to say is Bex has prepared a presentation. I don't know if you guys have seen it, but it's quite long. But I just wonder if it might be worth, because I think it might be worth pulling out from there some of the things about, you know, how we compare to other boroughs. There's some things in there which I think you might find quite useful and interesting. So I don't know if she wants to present that. I mean, I'll leave that up to you, Councillor Eggleston, and whether or not you as the panel want to see it. But it might just give you a bit more of an idea of the context.
Yes, I think that's going to be a really good idea, Bex, because it refreshes us, and we know, because we're now about to start, it gives everyone their complete focus. Can I just ask a quick question before we start? In schools, do they have anything like a school nurse who goes in anymore? Do they have a go-to person for those who haven't got like the modern technology or?
Yeah, so the local authority commission the school nursing service as part of the 0 to 19s contract, which my team don't manage, but there are school nurses on site at schools, and I could certainly ask Hema, who's your Deputy Director of Public Health, whose team are responsible for that contract, to make sure that that's supplied as part of this review as well, so you can see what's within the school nursing contract. The schools are legally required now, both at primary and secondary school level, to provide relationships education and in secondary school sexual health education. Apologies, as this isn't my area of expertise, but my understanding is that the relationship local authorities have now with schools is quite different since the introduction of the academy type model. So the extent to which Bracknell Forest councils are able to kind of influence what the schools do in terms of delivering on their statutory responsibility, I genuinely don't know. But that's personally, when I was working with Democratic Services, I said I think it'd be quite helpful for OSC to understand as a local partner how the local authority and schools might work together to make sure that is good quality.
Thank you. Could you present your slides, please, Bex?
Sure, and acknowledging they are, there's a lot of content, but I'll just whip through them. There's a lot of visuals, so do let me know. Is that displaying?
Would it be helpful if I presented them and you just said next slide, please?
Yes, happy for you to do that.
Okay.
Thank you, Megan. Thank you.
I just know I know it's hard to see when people have got their hands up, so let them go. Right. Excuse me. Right. Can you see this, guys?
No.
Not yet. Okay, hold on 1 second. The screen.
Yeah.
You can see my calendar. Hold on.
Yeah.
Right,
there's
1
no
second.
personal stuff here.
Here we are.
Thank you. Oh,
is that it? Can you see it now?
Not yet.
Oh my goodness. Why is it not coming on? Oh, it's over here. Right. Sorry, it's on the wrong screen.
On a different screen. That's usually the.
Yeah. Oh, I thought it'd be helpful.
There
Stop
we
sharing. Just ask share that one. Right. You should see it now. Yeah.
Yeah.
Yes.
Yep.
Sorry. Right. And then just shout next slide when you're ready. Thank you.
Okay, so this is only the second slide. The first one was an introductory slide. So I presented this at the previous overview and scrutiny committee I attended. This is just a run through of the services currently commissioned in Bracknell Forest and across Berkshire East to provide sexual health care. So Berkshire Healthcare Foundation Trust have the main contract, which you'll find in other areas. You tend to have one major specialist integrated sexual health provider who can provide all levels of sexual health provisions. That means even the most complex care for things like complicated intrauterine device fits or people with recurrent sexually transmitted infections, they need to be seen by that specialist service, and they can also see everyone else below that sort of hyper specialist level. They subcontract currently an organisation called SH24 who provide the home STI test kits, and as part of the new service specification, they're reviewing that service specification and the provisions to make sure the quality and the supply is better matched to demand. In Bracknell Forest, you currently have 8 of your 11 general practices providing the long-acting reversible contraception. Nationally, NHS commission all GPs to provide advice about contraception and access to most forms of contraception. It's just when Public Health split out of the NHS, for some reason, they put LARC with local authorities. So that's why we just commission that bit. We have a varying range of pharmacies year on year who want to sign up to the emergency hormonal contraception. There was only really one really active in that in 2023. People can purchase EHC from any pharmacy, but the reason there is a national service specification for those aged 13 to 24 is it's firstly recognised many of that age group won't purchase it, they probably can't, but also because it's seen as really important to make sure the pharmacy does more than just supply them with the EHC, that they also offer some safeguarding, so they'll speak to the young person, assess for things like risk of child sexual exploitation, and they'll also offer them some sexual health promotion advice about contraception. We are anticipating, and again, this is what I said last time, there is now nationally an NHS oral contraceptive specification. I know 4 pharmacies in Bracknell Forest have signed up to that, and that we're expecting more will basically be interested in the EHC and also be able to provide an ongoing supply of contraception. So I anticipate our pharmacy offer should improve. And then the Safe Sex Berkshire. And then the other ones aren't particularly relevant to this review. So next slide, please, Councillor Wright. So I thought it is useful, possibly as part of our overview and scrutiny process, to understand the things that are going well so that the focus on what's not going well is informed by that too. So next slide, please. So the first thing, just in general across the whole population, is that with regard to sexually transmitted infections, if your eye is drawn to that diagram, the orange line reflects the positivity rate. So that's the proportion of sexually transmitted infection tests Bracknell Forest residents have requested that have come back positive. And what you can see is that since the pandemic, we've seen a reduction in the numbers that are coming back positive. So it could suggest lower rates of sexually transmitted infections circulating. Although we did have an increase just before the pandemic. The blue line shows our STI testing rate. So as we saw nationally, we did see a slight dip during the pandemic in terms of the number of people requesting tests, but it looks like we're recovering beyond post-pandemic levels. And again, that trend in terms of increasing demand for STI testing we're seeing nationally, it basically means that people are more informed and feeling better able to go and get an STI test should they think they might be at risk. So that's a good news story. And it's also good news because that's coinciding with us actually seeing fewer people who've had a test testing positive for that. Bracknell Forest's positivity rates are significantly lower than the national rate and in line with local authorities with a similar level of deprivation. It's fine to be on this slide, Councillor Wright. In terms of HIV testing, we can move to the HIV testing one, that's fine, thank you. Prevalence and pre-exposure prophylaxis. If you look at the diagram, basically if there's a green dot, it means that Bracknell Forest are performing statistically significantly better than local authorities in a similar area, similar level of deprivation. The reason that's important is that we tend to see HIV and demand for PrEP more aligned with deprivation. So that's a better comparator than national. So broadly, we're performing really well in terms of lots of people coming forward for HIV testing across different protected characteristics groups. We also perform much better in terms of having a low, or in the recent data reporting period, a 0 HIV late diagnosis among heterosexual and bisexual women who were first diagnosed in the UK. Bracknell Forest has a much lower HIV prevalence rate compared to other areas similar to Bracknell Forest. And the little blue dot at the bottom is a is an indicator where you're not necessarily performing better or worse. It shows whether you're higher or lower. So we have a higher proportion of people who need pre-exposure prophylaxis accessing that and initiating it. So they're all our good news stories for HIV. Next slide, please. For long-acting reversible contraception, our prescription rates for LARC are higher than national rates, but slightly lower than the comparator deprivation decile rate. So again, compared to similar local authorities, slightly lower, but not significantly lower. But there is good geographic coverage. So of the 8 GPs who provide LARC in the area, if you see a little white blob on that purple map, to the right-hand side of my screen, that represents a GP practice who are offering LARC, and where there's a little green circle, that means there's 2 quite close. And the darker purple areas on the map represent more highly densely populated areas. So broadly, we have a lot of GP practices signed up to this, and they are located where we've got more people living. If you look just on the border of Bracknell to the east near Ascot, there is a GP practice in Windsor and Maidenhead just on that border. So again, recognising the high population density there is a GP practice offering LARC near to those people too. And our rate of LARC prescribing, this is just to show that, again, we have seen an increase since the pandemic. So we're starting to see increasing numbers of women coming forward for that service again. Thank you. Next slide, please. For under 18 conceptions, which is one of the main indicators we use to look at sexual health among young people, in Bracknell Forest, the rate of conceptions among people under 18 has been lower than the national average since the late 1990s, and it's been lower than the regional average since 2004. Deprivation is a really important factor associated with when young people first have sex, and when they first have sex is highly associated with the risk of teenage pregnancy. And Bracknell Forest performs better than most of the local authorities in a similar level of affluence. So the next couple of slides just show diagrams to back up what I've said there. So next slide, please. So the darker, sorry, one back, Councillor Wright. There we go. So the line graph at the top, the darkest green line at the bottom shows under 18 conceptions rates in Bracknell Forest. So you'll see what I've just said about us being lower for quite some period of time compared to South East Region in England. And similarly for under 18 conceptions rate and the under 18 births rate. Under 16 conceptions rate, the reason there's not a continued line is the numbers are so low, we don't have enough data points to map that. Next slide, please. And then here is Bracknell Forest under 18 conceptions rate per 1,000 women in 16 similar local authorities. So you'll see Bracknell Forest is right down the bottom there, and the green means that we're statistically significantly have lower under 18 conceptions compared to local authorities with a similar level of affluence. Next slide, please. The other thing we know locally is that we have quite high uptake, relatively speaking, of contraception among young people in general practice. So we know nationally across all age groups, about 70% of women choose to go to their GP for contraception, generally because they're a trusted source. They can offer a broad range of advice on contraception, and they can offer all forms of contraception outside of a specialist setting. And there aren't many other providers in any other areas in the country that can do that. In Bracknell, data suggests young people are finding that one of the acceptable ways of getting their contraception. So Bracknell Forest, you'll see as the top line, if we compare that to Frimley Integrated Care System geography, 2% 10 to 14-year-olds, 29% 15 to 19-year-olds, and 55%. And you can see across all of those age groups, relatively larger proportion of young people are going to their GP compared to Windsor and Maidenhead, which is fairly similar in terms of level of affluence and also the Frimley average. Next slide, please. Regarding specialist sexual health service, which we currently have BHFT for until June 2026, In the last 5 years, the service has performed well against its current contract, against its key performance indicators. So when I was asked earlier about things like the proportion of patients seen quickly, that's the sort of thing we have a key performance indicator for, and generally they've performed really well across all of those. And I acknowledge the point made earlier about the council not receiving complaints and possible reasons for people not wanting to complain about that. But the service themselves, so Berkshire Healthcare Foundation Trust, haven't received any complaints directly. And we know, and I'll show you on the next slide, that most Bracknell residents choose to access the service from the local service provider. So if we go to the next slide, I'll explain what I mean by that. So when it comes to what we call genitourinary medicine, or GUM, and now often they're referred to as ISH because they're integrated sexual health, so both STI testing and treatment, and also contraceptive services, they're often combined. People can choose to access those anywhere in the country. National survey data suggests there are a myriad of factors that affect where people choose to go. So, for example, if you might not want to go somewhere close to home because it might be more convenient or more anonymous to go closer to where you work or study. So people may choose to travel actually further to access these sorts of services if for some reason they don't want to be identified in their local area. What we've seen in recent years in terms of the bar diagram you're looking at here shows each column is showing the percentage of Bracknell Forest residents accessing those specialist sexual health services by the service provider. So in recent years, you'll see a much higher proportion of people have chosen to go online. That increased during the pandemic and sustained in the most full reporting year we've got. People also choose largely to either use the Garden Clinic or in Slough, or Skimpert Hill in Bracknell Forest, and also the Royal Berkshire site in Reading. There was a site commissioned, I believe, by Surrey County Council in Frimley Park Hospital that doesn't provide those services anymore. But what we can see is well over 80% in recent years, over 90% of Bracknell Forest residents are choosing to use the locally commissioned services when they could choose to go to Surrey or other bordering local authority areas. So again, for me, this is a good news story, because if they weren't satisfied, they might be choosing to vote with their feet and go further afield. Next slide, please. So some areas for improvement or further exploration. Next slide, please. So we completed a health needs assessment last year. It's currently in draft, but as soon as I've completed it, it can be made available to this Overview and Scrutiny Committee. But some of the high-level findings we identified, one was that although we're performing well for many of our HIV indicators, we are below the national target for late HIV diagnosis as a whole. And also we felt that access could be improved for some subpopulations. So for young people, we picked up on the fact that we have lower chlamydia screening and detection rates, and we were also conscious that in terms of a targeted provision for young people, there wasn't that much available, either through our specialist service, but also because of the challenge of having pharmacies sign up or any other kind of service setting. Neurodiversity, that was something local professionals raised with us. It's unclear the extent to which it's affecting the population, because the recording of neurodiversity in service tends to be poor, but we've suggested some engagement work to understand what would look like good service access for our neurodiverse population and what our providers could do to improve that. And then we picked up on differential access to contraception based on ethnicity, with lower contraception in all settings by women of Asian and white other ethnicity, and lower uptake in GP settings among women of Black ethnicity. Now, again, although we know actually that could just be down to preference. Some people, many pregnancies are ambivalent, and some people may choose for various reasons not to access contraception. We need to understand whether that is the case, or whether we need to understand that better. Next slide, please. So regarding HIV late diagnosis, Bracknell's late HIV diagnosis is significantly worse than the national target of having less than 25% of new diagnoses being late. Bracknell's historically performed worse, and that is strongly influenced by the fact that Bracknell has a really low prevalence. So a small number of new late diagnoses can significantly shift that percentage. If we have 7 HIV diagnosis in a 3-year period, it would only take a really small number to really sway how we look on that performance indicator. We're also aware none of the 13 local authorities in a similar area of deprivation are performing against that target. And Bracknell has one of the lower absolute numbers of late HIV diagnosis in the most recent reporting period, but regardless, we recognise there is a need to take action to reduce late diagnosis if there is anything more we could do. So if we just see the next couple of slides, Councillor Wright, please. So this one just shows what I've said about we've historically performed worse against the target for HIV late diagnosis. Next slide, please. This one shows how Bracknell fares compared to local authorities with a similar level of affluence. You can see the red basically means nearly all of them are performing significantly worse than the target, but you can also see in the third column along where it says count, in the 3-year period 2020 to 2022 we had 7 late diagnoses. You can see, as I say, in terms of absolute numbers, there are other similar local authorities in terms of affluence who fare worse in terms of the absolute numbers that translates to. Next slide, please. So actions being taken already, regardless of OSC, to improve that. We have a small grants programme for pre-exposure prophylaxis. We've recently commissioned a provider to work with high-risk communities to understand what's their awareness, beliefs and barriers to HIV testing, and also access to pre-exposure prophylaxis if they're eligible for that. Recently, as part of a national initiative, so it's not a Bracknell Forest initiative, local hospitals are now offering proactive HIV testing in accident and emergency settings. That's because it's been recognised that sometimes those not diagnosed in primary care might well be going through A&E. BHFT are auditing PrEP uptake, so they're looking at those individuals who are eligible for PrEP and they're trying to understand why they're not taking up the offer of PrEP. And they've also introduced opt-out HIV testing. So rather than before they would say, would you like a HIV test? Now they'll actively say, as part of your STI screen, we'll offer you a HIV test. If you'd like to decline it, can we ask you why? And they record that. They've also introduced point of care testing to help those who have needle phobia, so that's not a barrier. And they've also, BHFT have been successful in some grant funding to do some work with refugee and asylum seeker groups. We do know many of our late HIV diagnoses are among people who are not from the UK, recent migrants, and so they're trying to reach out into those communities. And finally, HIV testing is included as part of the basic online STI test kit screen locally to normalise testing. Next slide, please. With regard to access to services for young people, I won't go through all of this. As I said earlier, we know with a chlamydia screening and detection we need to improve, and we also need to improve the number of settings young people can access services from. So if we go to the next slide, please. This just shows that historically we have had a lower chlamydia detection rate. Again, it's linked to the fact that Bracknell's a more affluent area, so there could genuinely be lower prevalence of chlamydia circulating. So it might be something that actually we will always struggle to improve, even with really good screening offer. Next slide, please. And this one just backs up what I've just said, really. So again, it's comparing Bracknell Forest to other local authorities with a similar level of affluence. So although, yes, we want to be ambitious as a local authority and we do want to see increased detection rates, we're still faring similarly to other similar local authority areas. Next slide, please. So the things we're doing to explore and understand young people's access and improve it, as I mentioned earlier, we're holding focus groups with local young people to understand barriers to accessing both information and services for sexual health. We've developed a questionnaire, which I hope will be signed off to go out later this month, to local young people to understand their preferences regarding settings for sexual health information and services. We've been interviewing professionals who work with higher risk groups of young people to understand their views. And also we're working closely with the Integrated Care Board Pharmacy Commissioner and local pharmaceutical committee and local pharmacies to understand how they might look to improve their offer, signing up for our EHC service, but also the oral contraception service. I think I'm getting to the end of the slides here. Yeah, I don't think we need to cover this one. This is effectively saying what I've said about neurodiversity, that we don't really understand what the barrier is there. And finally, access to contraception for women of Asian, Black and other ethnicity. It wasn't just that the contraceptive access is lower. We know from the Integrated Care Board that ethnicity is associated with poorer maternal and infant health outcomes locally. And so the conversation we need to be having in partnership with our NHS colleagues is, if women are choosing not to access contraception or do not want contraceptive services, we at the very least need to work with the NHS to provide what we call good pre-conception care. So basically, if a woman's not on contraception, the things she could be doing should she become pregnant to try and make sure it's a healthy pregnancy. Next slide, please. And this is the last one. So these were just things in advance of today. I was asked by Esther to recommend some areas OSC could look into. So I've mentioned neurodiversity, contraception among certain ethnic minority communities, and also, as I mentioned earlier, really keen to understand the quality of sexual health education in schools. Thank you. That's the end of my presentation.
Thank you very much, Bex. Very informative. Does anyone have any sorry, excuse me, anyone have any questions, please? Councillor Virgo.
Bex, thank you very much. I just want to explore this a little bit. You mentioned that a lot of residents, maybe I shouldn't use it a lot, visit the garden room in Slough. Would it be possible to get the number of Bracknell Forest residents that actually do go there, or is that difficult to do?
You're on mute, Bex.
I can give you the data that's publicly available on that. I have a feeling that it's what we call throughput, because we obviously, I think we get what we call unique attendances and repeat attendances, but I can provide the committee with the information that's publicly available. The challenge we might have, as you can anticipate with the sexual health services, is how open people have been in terms of identifying themselves. But certainly I can give you how Bracknell Forest compares to some of the other local authority areas accessing that service.
I think what I'm trying to get at is people are using the garden room because they're not getting, direct facility from Bracknell Forest, because you're not open enough. You're only open one day. And the only way to do that is to go to the garden room and just check. But I think, if I remember, you don't have to give your full name in the garden room, do you? So I don't know quite how that works. So there might be no record of that.
There's a national data set called GUMCAD that we use that's as accurate as we can get, that will give us a sense of the number of unique Bracknell Forest residents that go there. The other thing to say about the Slough Garden Clinic site is that is for what we call level 3 provision. So people who need to see a really specialist doctor who wouldn't be able to see, for example, although there is the site in Bracknell Forest at Skimpote that's open 2 days a week, it might be that they've called the service and they've said, actually, for the type of contraceptive fit you need, or for the, due to your recurring STI, you need to be seen by a specialist doctor. And I think I'd advised the committee previously, but again, you'll pick this up through your review, that specialist sexual health clinics are a bit you have to think of them a bit like specialist cancer care services and other types of healthcare setting where you're not guaranteed 5 days a week in every borough. They tend to be modelled around a single hyper specialist site and then what we call spokes. So some of what we're seeing in Bracknell Forest, I suppose, is saying demand that perhaps is necessarily in the tier 3 setting, but recognise the 2 days a week might be a barrier for some people who could otherwise be seen in Bracknell.
Could I just have a supplementary? Going back to the HIV problem, Bex, and the late diagnosis, why do you think that is, basically? What's your opinion?
So based on the information we picked up in the health needs assessment, I think partly for Bracknell, knowing that we have to be careful. We have to be careful what we can disclose publicly with this, because as I say, we're looking at 7 diagnoses in a 3-year period, so it's a really small number of people. What we do know from Berkshire Healthcare Foundation Trust, who also provide the HIV treatment, is a lot of those people are people who arrived in the UK within the last 2 or 3 years, and so either as part of their entry to the UK perhaps haven't accessed healthcare, perhaps they've had other needs more pressing like accommodation, whatever else that might be, are not familiar with our healthcare system. So that's partly why BHFT are doing this outreach work with refugee and asylum seeker populations. The other thing could just be, so some of the late diagnoses seen nationally are in older age groups, people who wouldn't have thought they're at risk and haven't tested, which is why it's so important that we normalise HIV testing through things like HIV Testing Week, or if you have an STI test screen, you're offered that as routine now. So it's not seen as only if you're at risk. Anyone who thinks they need an STI test kit's told you should have a HIV test, and if you think you shouldn't, can you tell us why, so we can understand that. So I think some of it's new entry to the UK and some of it's low risk groups who frankly will be really difficult to identify, but what you can do and what we are doing is to just normalise testing if anyone thinks they need an STI test of any sort.
Can I just expand it? Sorry, Carol, just one more thing and then I'll get back. If someone calls you in the clinic and say that they're worried about something, obviously you would try and fix an appointment, would you? That would be the first thing. But would you also try and do that by camera, by as we're doing now, like Teams, or the same system? Do you have that capability?
So at the moment, I don't think BHFT have continued particularly with what we'd call telemedicine,
okay.
But it's something, again, we've asked them to explore as part of this new service model. So we would pick that up in triage.
Okay.
But I suppose, just to qualify, when the committee originally asked us about STI testing online, a point I'd emphasise is that, yes, it's really important that people who want to access the service, their preference is to go online. We need to acknowledge that, but what we need to do is make sure that's a really good quality offer, so they're not just getting multiple STI test kits, they're not actually getting the consultation that advises them.
Yeah, understand. Thanks, Caroline. Sorry, I was wondering.
That's okay. I just wanted to follow up on that as well. So if there is a language barrier, what are BHFT doing then? Is there like a translator service for them? And are they?
Yes.
How are they made aware of that currently?
I don't know how BHFT are promoting the translator service. I know they work with local voluntary community sector community groups to try and raise the profile of the service, but I think that's something they've acknowledged they need to do better. So again, a new aspect of the service specification they'll be working to from the 1st of July has increased what we call outreach provision. So what's covered in that is saying to them, it's great to have these clinical sites, but what we need to make sure you're doing is reaching out more into those higher risk groups.
Lovely. And does that also mean they're working alongside faith groups to perhaps reach?
I don't know if they're working alongside faith groups at the moment. I don't believe they are, but that indeed could be part of what they do with the new service model from the 1st of July.
Thank you. Has anyone else got any questions? No, thank you ever so much, Bex. That's much appreciated as always.
That's okay.
So
Happy
thank
to
you.
help. I've noted some actions, and I guess I drop off the call and let you have further discussion, or I can stay if you want me to.
Whichever you choose, Bex, is absolutely fine by us.
Okay, thank you. I'm happy to
So,
stay and listen just in
yeah.
case there's anything else I can pick up
Yeah,
and assist with. Yeah.
absolutely. So thank you everyone, and thanks Bex for that. So what's going to happen now, as I explained, is we're going to be having discussions on, obviously we need to start taking this forward now. We need to present this in the July overview and scrutiny. And so obviously we need to be finished this by the end of May. And what with holidays and that coming up, we need to sort of get a move on with it. So the first thing we're going to do is work out different scenarios of people, perhaps with the help of Bex as well, to help us with our mystery shopper as such. So that would mean a difference of people, counsellors on this group who are happy to go along and see if they were almost like doing a role play on different scenarios, accessing, as we said, online. How would they find that from different, if you were had problems with, or you had neurodiversity, or if you had a language barrier, or you're trying to do something quite secretly, would that be achievable online? If you wanted to go along and you knew it was at the Guardian Clinic, could you just walk in there? Are there any leaflets you could pick up? Are there any barcodes that you could scan where the Guardian Clinic is in Bracknell? So have we got in the group 4 volunteers who would like to do the mystery shopper part? Don't all shout at once. So we've got Councillor Virgo. Thank you, Sophie. Thank you, Jerry. Anybody else? And Sharice. So that's our 4 for the mystery shopper. And what will happen is, don't worry, you will be given like a question sheet. So although you'll all be doing something slightly different, you'll all be asking the same questions. So when it comes to reporting back, you're not like devising a report yourself, you're just answering some questions. So then we've got other parts of it that I'd love volunteers for at this point. Anyone would like to do the desktop review of the school relationships and sex education, RSE and policies? So Esther has kindly sent us the link to where all these policies can be found. And then we can see across Bracknell exactly how different each school and what each school is doing. And perhaps, because that could be one big issue if everyone's doing something different and they're not signposting to these services that Bex and her team are trying to put in place. So is there anyone who would like to take that part of the review on? Thank you, Janet.
Okay, fine. Okay.
And who else was that who said they wanted to do it? Would you like to do that, Sheila? Perfect.
Yeah, will do.
Lovely. Is there anyone who hasn't got a role that would like one at this point? Councillor Harrison, is he still there? You can't hide even with your camera off.
I am here. I was just trying to find the button to switch the microphone back on.
That old chestnut.
Yes,
So
fine.
are you happy to join in with the ladies on that one?
Would you like to rephrase that? So,
Yeah.
so what is it?
I
you'd like me
know
to
what
do?
I mean. So that's the review and analysis. Well, that's the desktop review of school relationships and
Yes.
sex education.
Okay. I'll
So
do that.
Esther's kindly sent everybody the links. So it's something that you can do as and when, but we're aiming for this to be back in about 2 weeks. So we can gain all of this, so we can start forming that part, so that when we sort of start talking to the youth champions, we've got a rough idea of what's happening, because we've reviewed it and we already know what's going on in schools, and then we can talk to them having the evidence in front of us and asking them what they would like to see different. So has anyone got any questions on that?
Presumably, Caroline, as Bex was saying, we don't have a lot of information about non-council schools, do we?
Yes.
So that's a more slightly trickier way to find that out.
Well, that's where hopefully our youth champions will be able to help us on that one.
Yeah.
And it'd also be for Janet and Sheila, perhaps something they could ask, because even once again, you can put your mystery shopper hat on. You know, you're interested in the school.
Yeah.
What's their policy? Could they
I would just be interested, because I'm opposite Lambrook School, you know, and I'd be interested the difference between what they say at Lambrook and say at Brackendale or something. I'd just be interested.
Yes, I think this is going to be very interesting, because I'm sure they're all going to be very different, within a stone's throw of each other, all these schools.
Yeah.
And if we can recognise that, it's something we can talk to the children, the young people about, because it'd be very interesting to see how they signpost as well to the wonderful services that the team are trying to set up. And obviously it's got to start within the school area. So that's going to be very interesting. And once again, there'll be a template. So don't anyone panic. You know, you don't have to sort of like, once you've sort of had a look and reviewed, we'll come to some key points that you've, rather than having to think you've got to write an essay on each particular one, we will be looking at specific points that we can bring back. And then you can compare amongst yourselves as well at how different. So what will happen is then I'll work with the team, and we will get the templates of what questions you need and some scenarios for our mystery shoppers. And then that's what we'll be doing over the next couple of weeks. And then the next time, obviously, if anyone's got any questions, please ask them. And then the next time we come back, it'll be very interesting to everyone to be able to share what they've learned so far before we then engage with the next part. If everyone's agreed to that, has anyone got any further questions?
Yeah.
Jerry, you got your hand up.
I've got my mic off now. Just you said you were going to look into schools, and obviously I'd like to know whether that would include FE education as part of that, because you've got 16 to 18-year-olds. Have you got any desire to look at that set of that area?
Yes.
That's a sort of age group in
yes,
college.
because we're covering the sort of under 25s.
Yes,
it will take us all the way through,
right? So that
to where they're going to be taught that, or at least be able to gain the information, because even children, young people, I should say, at college, how are they informed?
They do have people come in, but obviously that's something that you might like to know a bit more about what's going on. I notice there's quite
what are they going in for compared to the secondary school setting?
To compare what they're being taught or shown compared to secondary schools.
Because I would like to think, obviously, there would be a big difference in what the children and young people can gain up during secondary school level. Then we're moving on to college. I would assume it's they're given more information. Because that's the time in their life that they actually need it. I hope it just doesn't drop off at that point.
But then I suppose when you look at schools, you've got sixth form, which would equate to the same sort of information that people at college would get. Yes. because
But
of the
do
same
they?
age group. Yeah, I don't know. This is what I'd like to know.
Well, there you go, you see.
Yeah.
This is what we're going to be feeding
Yeah.
back as
Yeah.
to how it changes and what the service is that we are providing our children.
Yeah.
Yes, Councillor Harrison.
Yeah, just a comment. Even when I was at university, there was just posters everywhere about sexual health, and they gave out condoms at freshers' fairs. So I think it's very high profile and very, you know, very in your face in colleges. In schools, I think they're probably going to be a bit more restrained about that, because it's not so much student to student communication as teacher to student, and they've got to be a bit careful about how they do it. So it'd be interesting to look at how it is actually communicated in schools.
Yes.
Hasn't the government just stopped giving condoms to a certain group? I question. I thought I heard this, but I didn't understand it, to be honest. But there you go.
No, that's something, because I like I said before, I mean, I remember very much up by the Grange in Bracknell, there used to be open places where the children and young people, because it was children as well, I'm sort of saying like 12-year-olds, etc., who were going up just out of curiosity. And sort of, even if it broached the conversation of, look what I've picked up, and you were sort of like, put it down. It sort of started that conversation with them.
Yes.
You know, and if they knew what it was, that was a good thing, because they were being taught at school. You know, but we don't know, being sort of older.
It's interesting, Caroline, because there's a lot of controversy from Asian groups, isn't there, that they don't want sexual education spoken at schools. They feel, I'm paraphrasing, it should come from the parents and not from the teachers or the, you know, whatever. I don't know how that affects our borough and whether there is a problem there, or, you know, whether that's...
Well, that's what we'll be finding out.
Yeah.
That's
sorry.
the interesting thing. Is it because some who decline and say, I don't want my children in sexual education at school? So where are they learning it from?
Yeah, quite.
Is it from social media? Are
Probably
they
from the internet? Yeah.
You know, how are they getting the information? Should they need these services then, if they're not in the room where the information's being given out?
Quite.
It's important to look at how they approach pastoral care in the schools as well, because usually there'll be a head of form or something that is a teacher that is specifically designated to look after the welfare of the children, more so than not just the teaching.
That's
or form tutor or something of that sort, however they do it now.
That's it, because that's one thing, a question can be added on to the schools if people want to sort of get more involved. Okay, you're reading the information on a website, but how does that work in reality? You know, is there someone that they can go to
discuss it?
To discuss it. I mean, that's what we used to have back in the day. But is it the same? And are the children comfortable with that person that they've got? I mean, and this is where our youth champions can come into it as well, to advise us so we can take it forward on the best way that they feel that maybe they haven't got so much of a voice. And I mean, I personally, I'm even around schools, even if they had like posters up where they had one of these scanner things on that you just like zap it, go off and look at the information later. I mean, I don't know what is actually in schools, but the school team have got a lot of work now to have a look at and delve deeper if they wish to, past the policies and say, actually, I've just read that and I've got a couple of questions on that. Because you can go as deep as you want to. And mystery shoppers, of course, you will have different scenarios. Now, you know what you're particularly looking at on this. You're going to be particularly looking at the neurodiversity. You're going to be looking at those. So when you're sort of doing your role playing, think of those who have not either the language skills or have different, you know, they might need translation services. To those who might have something more complicated, they ring up and they're told, well, hold on, we don't do that in Bracknell. You've got to go to Slough. They're 15. They haven't got the transport. They haven't got any money. They're not allowed out on so-and-so to go to Slough.
Yeah.
So you've got to sort of, this is where you can do a really good review on the fact of, well, how would I get there?
And if they phone up their GP, are they going to get the 3rd degree from the receptionist who wants to triage them?
Yeah.
Which could be a bit of a barrier to actually accessing those GP services, especially for teenagers who don't want their parents to know what they're doing.
Yeah, I think that's a good point. It's a very good point, because I think if you go to GPs, the basic thing is you've got to write down exactly what the problem is. And, you know, there's a big, I mean, ridiculous, I think, but, you know, there's a big pro forma of, have you done this? Have you done that? You know, who's going to do that? They're not.
Especially that age. So
yeah,
it's
but
accessibility.
we don't necessarily know that, though, because obviously we're looking at it from our point of view. We haven't, you know, if we pretend to be a child, it might be a very different story to what they can actually get from a GP. So that's the whole point in this, to find out exactly what is being offered.
Yeah, so you can all put your Poirot tashes on and really delve deep. And I can already see, particularly Charisse and Tony, and you're going to drag the other two in with your false glasses, your false nose, a beard.
That's right.
We all know who you are.
Don't you worry, I've got a uniform.
That's it. We've already got you sussed. But thank you ever so much for your time. And I do apologise for running over tonight, but now everyone knows what they're going to be doing. And hopefully everyone will enjoy what they're going to be doing, because I think it is going to be, we can really delve deep in this.
Yeah, I agree. It's great.
And add real value, because obviously this contract is coming up.
Yeah.
Our young people getting good value for money.
Yeah.
As the residents are paying for this service. And I'm sure they'll be very invested on how we're spending the money as a council, and to make sure their young children are safe and have services to go to if they can't get, particularly if they can't go to their parents.
Yeah.
So thank you all for your time tonight. Much appreciated. And thank you for coming, Bex. And as always, thank you for your review and everything.